I don't think.
Are we back?
Are you on? There you go.
Are we on?
Yeah.
I got a handheld microphone. This is Dr. Milan Shah from the Beautologie. This is my sweet Stella sign. That's my equally sweet Stevie Ray Vaughan Strat. I'm not used to being off the kilter a little bit. Here's the deal. Apparently, there's a lot of technology out there in the world, and we were talking last time he was on the show about lasers, and he's gonna beam me with this very expensive, or this nice lady, Lilly, who's a registered anesthetic nurse. Dr. Shaw, what is this thing going to do?
So the venous freeze, I won't beam you anywhere.
Right, you got right up on the microphone.
Oh, I'm sorry.
Yeah,
so the venous freeze laser, we've talked about it a few times in the past. It's our kind of the buzz right now. It's our hottest laser, especially here. Getting ready for the summer months. Everybody wants to trim down, lose a few inches, tighten up some skin. The venous freeze laser is wonderful. It's a procedure that doesn't have any downtime. It's an in and out procedure. It works to accomplish a few different things. One, we're using it to tighten up areas where after several years out in the sun, or just because of natural aging, skin starts to get loose. So it tightens up skin, and then at higher temperatures, we could actually shrink down areas, shrink down the circumference of areas by breaking down fat cells. And so I know we've talked about going after your back a few times. You've worked out as hard as you can.
Yeah, I lost 50 pounds.
You've done quite a bit, but there's those stubborn little pockets that you can't go after. And if you don't want to go under the knife, this is a wonderful alternative. So the venous freeze is what we brought here today for you.
It's just, and I would think it'd be, because honestly, I don't want to be a downer about this, but I got pretty fat, and then I lost all of it, and I don't have any loose skin or anything. My skin's nice and elastic, but this little bit right here, and I don't think I haven't tried. It won't go anywhere. There is nothing physically, exercise, diet. I cannot imagine the dietary restrictions you'd have to burn this fat off right here.
But it's a lot of fun to get a handful of.
I didn't need to hear that really at all. So if Lilly here beans me with this thing, it'll instantly be gone forever, and I can eat cupcakes while I'm doing it. Is that?
Not necessarily. I mean, it's going to definitely go after that stubborn pocket, that loose skin plus that little bit of fat that you may or may not have. It's going to do both. It's going to take a few treatments. It's not going to go away with just today's go. You may see results just after one go, but it'll take a few treatments. But, yeah, no, you have to watch your diet and, your nutrition.
I'm already doing that. That's what's so irritating about all this. And I didn't know I was going to be, my feet would, or I would have worn nicer shoes today, but I'm playing tennis today, so I just went ahead and wore my tennis shoes. But the people at Babolat will be really happy because they get a nice little plug there. So, all right, Lilly, blast me with your $60,000 machine.
All right. Well, I'm going to have you face this way, Scott, if you want to turn towards me just so Lilly can see your
this is going to be horrible. You might want to turn off your iPad or whatnot because there's going to be some screaming.
No, this is going to be great. I can't wait.
Is Lois anywhere near? Oh, really? We're going to do this on
Yeah, Scott, sorry.
Oh, look.
Oh, yeah.
That's gross.
That's good skin.
I didn't wear a belt. I didn't do it. I wasn't planning on any of this.
That is prime rib.
That is just horrifying right there. I'm going to put my microphone down because
can you hold up the mic to? I don't know.
So what we're doing right now is we're putting on this special glide. It's a gel and it makes the venous
baby.
The venous itself needs that glide, so it conducts its energy. What it uses is radio frequency energy, so it conducts that radio frequency energy down to your fat cells and also down to where it's going to be stimulating that elastin and collagen. So that's what Lilly's putting on right now.
Yeah. You got any extra tubes of that?
Oh, no.
No? All right. Yeah, they're slathering it all over his back. This is, hi, Scott.
Hi, Hop.
What are you doing after the show?
I'm going to play tennis.
Oh, you're playing tennis.
That's the great thing about this procedure. You can get it done and go carry on with your life.
Yeah. Okay.
That's absolutely
here we go.
True. All right, here we go. So,
and it's it almost looks like a shower head.
Yeah, we call it multipolar radio frequency. There's a bunch of poles on there that are delivering this heat.
Ooh.
She's getting it started. You're gonna feel a little bit of heat. She's got you at a pretty good setting right now. What Lily's doing with the yellow gun in her hand is monitoring your temperature, and she's gonna.
Just get this done. I want instant results right now.
So, how does it feel right now?
It's nice and warm and it's very soothing. I'm for that. It's like a massage.
Is it a massage? Do you feel any warmth or heat or anything? A little bit hot.
I could go for more.
Yeah. So is that actual lasers coming out of there?
So, we term all these medical devices as lasers. The actual energy that this machine uses is not truly a laser light. It uses two different energies. It uses radio frequency, like radio waves, the radio waves we're using right now, and magnetic pulses. And radio frequency has been around for many, many years. We know that and magnetic pulses together do quite a bit to stimulate collagen, elastin, and break down fat cells.
And for those of you that can't really see this, the young lady, and what's the young lady's name again that's doing this?
Lilly. This is Lilly, my nurse over at
in one
Beautologie.
hand, in her right hand, she's got it looks like a shower head that she's rubbing all over Scott's lower back, where it's kind of like fatty, and she's rubbing it pretty hard on there. And in her other hand, she's got this. She's got like a laser thing that's pointing and zeroing out the parts of Scott's back that I don't know. It's I've never looked at you quite this way before, Scott.
Nobody has. That's why this is
Yeah, this is it's mildly erotic.
It's supposed to take like 40 minutes.
Well,
right?
yeah, I mean, a proper treatment is 40 minutes. Lily's almost got you to the therapeutic temperature. She's got you at 39 degrees. We're aiming for about 40, 41.
Ooh.
And that's when we start, tightening that skin. And then a little bit beyond that, we start breaking down those fat cells. So we're almost there.
You look a tad uncomfortable. Are you okay?
No,
You're hunched over.
I got one part of my body that's gross. And, let's by all means, just point a
Oh,
camera
believe me,
right
honey,
at
I'm looking at it. You're not
Janet
gross.
Varner could be watching.
There could be. You're getting red. It's getting pretty
That's how
red.
you know it's working, Hop.
Is it?
It does. It's getting plenty. It's getting pretty hot now. Not
Is
in a
it?
bad way. It doesn't hurt or anything. It's
Yeah.
perfectly fine.
So how long does a normal procedure? How many of these? Like you got love handles, you want to get rid of them. Is it just one procedure and it's gone, or is it a series of procedures?
It's a series of procedures. We have our patients come in once a week for 2 months.
Yeah.
And usually at the end of the 2 months, we've gotten pretty good results. If we measure, say if we're going after fat, if we measure a patient's belly circumference, about 10 treatments or 8 treatments into it, we're usually getting about 1.5 to 2 inches in reduction.
And what does a patient have to do in between? Man, you look like you're sunburned. I swear to God, it is red. But in between treatments, is there anything a patient has to do? In other words, a restriction on either diet or bathing or anything that they have to do to.
No restrictions at all. His back is going to look a little red, a little flushed here for about 30 minutes or so. So we're not going to, we're going to tell him not to go jump in a hot tub or go take a hot shower right away. But other than that, there's no real restrictions. As far as activity, normal activity, we're not. You don't have to go on a specific diet with this treatment. We're killing the fat cells for you. But at the same time, you want to protect your investment. You don't want to eat that tub of cupcakes at the end of the table.
Well, yeah. But how you feeling, Scott? Is it okay?
It's the weirdness of getting this. See, normally you go to Beautologie and you'd be in a room, just Lily and I. There wouldn't be a lot of cameras and microphones and that lady taking pictures with her iPhone, which is creepy as hell. And all of this, you know what I mean? This is a heck of a thing to go through publicly. I'm doing this for everybody else.
You should see, is there, John, can we get a real good shot of his back? Because it looks like it looks like somebody's giving you an Indian rug burn. You know what I mean? The old...
Oh, look at that.
Oh yeah, you are pink. Well, you're my little pink pig. Yes, you are.
Let's just
you're my little pink piggy.
Any way anybody but
He's a sweetie.
Well, that red is exactly what we're looking for, and Lily's got to the temperature that we're looking for, so it's working right now. It's
getting in there.
And if we went through the entire treatment, you could probably see some pretty good results just after this first go.
Then can we do? We'll just do after the show's over. Can we just sit here while Lisa Kurtz is doing her show or whatever? And
I think we're going to let Lisa try.
Are you going to do this to Lisa Kirsch?
Lisa's perfect. You won't touch her.
Well, she's going to graciously volunteer herself. She is perfect, but we're going to. I think the plan is we're going to show a different aspect of this laser.
Wait, come here.
Yeah, invite more people.
Yeah, come here. Look at this. Look, I'm trying to bring Lisa Kirsch over here so she can see exactly what she's in for. Sweetie, get in here and look at this.
Wow.
Isn't that great? Isn't that crazy?
Yeah.
Now, are you going to let him do that to you?
Certain parts.
Yeah?
Sure.
But, wow. Is there any, I mean, do you do this on, like, thighs and what other parts of the body
Just about
can you
any
do?
body part. Any area that you're looking to get rid of fat, arms, thighs, love handles, buttocks, the belly. we're going after all.
How about neck, cheeks,
Necks
that
and
kind of
cheeks.
thing? Yeah, really? Yeah.
Depends if you want to shrink down the area or tighten up the area. You can do both. So
How do you feel, Scott? She's wiping you down.
I want to. I wish they could. I'm going to do treatment tomorrow. I wish they could. Could you guys come down to the blood bank and do this while I'm in the treatment chair? I'm stuck there for 96 minutes anyway. Put the phone away.
Sorry, just doing my social media duties.
Oh, no.
Yeah, all sorts of people are taking pictures of you.
Well, it's time to take a break. Let's go take a break, and they can do the other side. You can do,
Yeah,
you can't just do
can you
one
give him the
side.
mic? Just,
Well.
hey, Scott, why don't you get right up close to that microphone there?
If this wasn't your birthday, we're going to take a break on that happy note. We'll
Yeah.
be right back. It's First Look with Scott Cox and Lilly and Milan and the whole hee-haw gang. Lisa Kirch is in the building. So go to Facebook and you can see my only fat bits because they're still there. We'll be right back. It's First Look with Scott Cox. It's Bakersfield.com and News Talk 1180 KERN. And we are back. Apparently, Bob just did the creepy arm gesture. But Lisa Kirch is in the room, which is always nice. Hi, Lisa.
Hi there.
Lily's back there.
Thank you.
Basically rubbing on my fat with what appears to be a $60,000 shower head. Dr. Milan Shah is he's supervising the thing because he's the guy who wrote the check for the $60,000. I don't know what that lady's here for. And Hop's here just to make me feel really creepy
She
about the
brought
whole
you
thing.
paperwork you need to sign.
Oh, that's
Yeah,
right.
you need to
right.
sign the paperwork.
Too late now. And Dr. Shaw, what do we do? What is this thing that she's massaging my fat with?
So again, it's the multipolar Venus frequency laser, and we're actually going after your
Wow.
skin, and we're tightening it up, and we're shrinking fat cells down right now.
So my fat cells are, and they're not going to plump back up again after they shrink. They're going to just get in my bloodstream and leave my body.
They will, and unless you eat that tub of
I'm not
cupcakes at the
done.
end, but
I've got the diet thing dialed in. That's what's so maddening about all this. For a year, I've tried
Yeah.
to get rid of all this fat, and it's the only part that won't go away.
Man, that is a flattering shot of you.
Yeah.
well, it's a
really
it's a
is.
common complaint. And we have a lot of clients that say exactly the same thing. You know, they're running the treadmill every day. They're
Doesn't
doing
work.
boot
There's
camp.
No exercise
Yep.
that works.
Eh.
You would have to get a level of diet, and it would have to. In 10 years, I'll bet this. It's the only fat in your body that won't go away. It just, and believe me, I've done everything there is to make it go away. It won't.
Yep. And up until just a few years ago, liposuction was the only remedy for this. But as science progresses, as new inventions come out, they figured out lasers that could actually almost replace liposuction. And this is well on its way. It's not going to give you those dramatic results like lipo, but after a few treatments, you're getting pretty close.
Do you think Darshan could come in on Monday and just do the lipo thing and just jam a needle in there and just get this over with? Because that I get, because I'm basically a caveman. And you look, and there's like a tube, and it like sucks all the goop out of you, and then it goes into a little bag, and then Brad Pitt will steal it later. I'm for that. I don't know what the hell's going on here. All I know is you're killing these fat cells, and then they will be released into my body, and then it'll just get flushed out of my system.
Right. And so, there's a component of your fat cell called triglycerides. And when you break triglycerides down, they're called free fatty acids. So this laser, not to get too technical here, it stimulates a hormone that breaks those fat cells down. It's a free fatty acids. So they're not collecting in pockets, like this, like the back. Not to mention, we're also tightening the skin, so you're getting the best of both worlds here. We're shrinking the area and tightening it up at the same time.
Should I be worried about the sound that
The
machine
noise?
just made?
No.
Nope.
I'd be more concerned the fact that she's wearing gloves and nobody else.
Yeah,
in
what's
here
up with
is.
that? It's non-invasive, but still she's wearing the rocking the gloves. Wow, look how red that is. That is crazy.
Yep.
And people can use this for any part of their body that they need work on.
Just about any part of the body, any area that you want to reduce the size or tighten the skin.
Okay,
Absolutely.
now I know that this takes about 40 minutes, and we just did like 5 minutes on a side.
Well, we actually got you to about 10 minutes. And so, Lily, we usually do about 40 minutes on the back, right? On the full back. Actually, lower back is about 20 minutes, and we do full back, it's 40 minutes. So you got about half a treatment in, so you're doing pretty good with your first go.
Okay, so but how many of these things before you really start noticing that it's because it doesn't go straight away?
No.
Those fat cells have to still go out
Right.
of you.
Well, that process takes a couple months. And so, after today's treatment, you'll see the maximum benefit in a couple months. But usually, if you want to hit it hard, we have you come in once a week for 2 months, and then we see how everything looks 3 months after, and that's for the maximum benefit. You may see results just after today's treatment. Sometimes it takes a couple goes to start to see those subtle differences.
So if I went in, and your brother Darshan's the guy. And by the way, congratulations on your in your Best of Bakersfield deal.
Thank you.
It was
Thank
a
you so
lovely
much.
photograph of the two well-dressed individuals.
Appreciate it. Thank you.
Is there any? There's obviously a competition. You want to blast people with the laser, but he wants to get in there with his suction tube, right?
Yeah, absolutely. Yeah,
Is
we're
that up
always
to
fighting.
the patient, or is that something that you guys just evaluate together?
We duke it out just like we did when we were
Look for it,
kids.
yeah.
We're fighting for the toys all the time. So
Wrestling around. Just got a minute. Okay, it's lipo. It's lipo. Okay, well, I feel very thin right now. Thank you, Lily. I'm assuming that's like all there is to it.
that's
And
it.
we,
You
and
did
we had a
great.
winner on the Menudo tickets, but I haven't heard who it is.
Well, whoever
so.
it is, he can come get his tickets. And
Yeah,
if
they
you,
pick them up here at
also,
the California.
We could do that again. Be caller 11.
Regina.
Right now. We got more.
We do have more.
We got
So
more. We got a whole envelope full.
caller 11 very quickly 842-5376. We got one more pair of Menudo tickets to give away. You'll pick them up here at the Californian Building, 1707 I Street, between I guess between 9 and 4 o'clock or something like that. So
This is the strangest thing I've ever
842-5376
done
caller
on the air,
11.
and that's saying something. It really is.
Yeah.
But it's because people don't. You don't want to just give up on this. You can absolutely do it. If there's some part of you that you think you can improve through technology, well, go do it. There's people there to help you with that. There's absolutely nothing wrong with it. That's what makes you happy. And I'm telling you right now, anybody who's lost a significant amount of weight, I mean a lot of it, like 40, 50 pounds worth of weight, there's going to be stuff that sticks around. And they don't tell you this when you go on a diet because nobody wants to discourage you. Yeah, way to go.
Go ahead, have one, Lisa.
No, yeah, we're talking about.
She's like the Vanna White of cupcakes. But at any rate, she's like one of those Price is Right ladies. Just does
Yeah.
but seriously, when you lose a bunch of weight, there's still going to be stuff that sticks to you. And because you lost the weight everywhere else, it's those little parts where they stick to you that will drive you crazy.
And the older you get, I think the harder it is to lose some of those specific.
I wouldn't know
ones.
anything about that because I'm not 50 or anything. But
That's
so go to Beautologie and ask them what's for me, and then you could watch them fight it out over whether or not they jam a tube in you or just do the little lasery thing. But I can tell you this: it's not unpleasant by any stretch of the imagination. It's easy to do. Didn't really bother me. I'm bright red now, but that's kind of okay. I'm telling you, if you guys want to bring that, you guys should come up with a deal at the blood bank where if you go down and you do Trima, they will do your fat with lasers while you donate. I think that'd be good for
I
you
think
guys.
you're onto
It'd be
something.
great for
Well-
the blood bank.
yeah, we'll see what we can work out with
Call
those
Mr.
fellas.
Gallion, yeah.
Call Gallion up and see. It was a really weird experience, so thanks for doing that, Lily,
Thank
especially
you.
because you got the gross job. And the rest of you, look, you folks listening here at Kern Radio, we got coming up next, we got the Money Wise guys. They're really smart about the monies in that. And then we got the Sean Hannity, and then we got the Ralph Bailey show. He's got, what is it, Gene Fuller on today?
Something political. He's going all political
No,
today.
wait a minute. He's 32nd District today.
Yeah.
That means he's going to be doing Pedro and the other cat. So there's that. But if you got your device in that, and because coming up next will be Lisa Kirch, who's marrying some dude. Brilliant. That. At any rate, you could watch her, and then Dr. Shaw will continue, and I'll hang around for a few minutes, and I don't really have any other parts of my body to get lasered, but there must be something. Did you bring any other machines with you?
That's the only device today.
Well, it's a fantastic chair, and I'm not leaving it, so there's that.